what have been your personal frustrations dealing with IC?
For me, there's been so many different personal frustrations. One of them being that I'm in constant pain and discomfort, and it's really hard to find a long-term solution to relief. And on top of all that, it's really tough when there's not a lot known about the condition and no one has heard about it. There's not enough awareness around it. So it's really hard for people to understand what you're going through unless they're experiencing it themselves. Since doctors couldn't help me and I had never met anyone that had even heard of the condition, I would turn to the IC message boards on the internet and I would talk to other patients and find out what they were experiencing and what they were finding for relief. I found that my best option was just talking to other patients and then doing elimination diets and, finding what worked best for me, since the condition is so individualized for everybody. I'd have to say that one of the most frustrating hurdles that you have with IC is that you never feel well rested. I constantly feel like I'm just some sort of zombie walking around because I have to get up in the middle of the night so frequently, and my bladder is in constant pain. So it's just like sometimes when you're trying to rest, you can't ignore that. And I end up staying up. So that's one of the biggest hurdles that I've found with IC is not being able to get adequate sleep.
And then the irony of that is, that stresses you out because you don't feel well, and then stress aggravates the IC. So it's this kind of vicious cycle. Yeah, I do not envy people who have IC, and it's very frustrating.
I just think back to the days when I could sleep like even 7 hours without getting up. That's like a huge deal. I cannot sleep. Like, it seems like for me, sleep is in like 4-hour blocks to where I'll have to go. But it's just so hard to ignore that pain and urgency when you're trying to sleep. It's so frustrating.
When you start your practice many years ago when I did, you really don't get much training regarding interstitial cystitis. And so you don't really understand how to diagnose these patients, how to help them. You hate to admit it, but you think as a doctor, you know a lot, and this just must be some other, crazy person looking for pain medication or something, or who just, needs to relax. And then you come to find that, how can you not be a little crazy when you're in pain all the time? And it gets very frustrating. I think by the time you've seen your 10th doctor, it's hard to come across as a reasonable person.
For many years, I felt like I was literally living in some kind of like other dimension. Like I felt like I was living a nightmare every day. No one could help me. I couldn't find relief on my own. And it just was really horrible to not have answers.
Although we know a lot in medicine, there's a lot we don't know. And I find that patients appreciate when you just admit, look, we don't know what causes this, but I'm just going to try my best to help you feel better and live, your life to the fullest.
As a physician, what frustrations have you seen with your patients who have interstitial cystitis?
I think the biggest frustration is not knowing what caused this. You don't know when you get a flare for a while. You go out to eat and you don't realize what was maybe in something. And so you got a flare from some ingredient that was in there. They don't realize maybe something was more stressful than they thought and brings on their symptoms. My frustrations as a physician are the same as what my patients are feeling, that I don't have something that consistently helps. I don't have some magic bullet that tells you or that can treat you every single time. Over the years, what I have really learned helps patients are what they have told me that helps them. Things like, taking aloe or other supplements that can really help their symptoms. And that's how we really chose the ingredients that went into Femetry, because these are things that people were using individually. And so it's nice to put them all together so that people can take them and not have to get them willy-nilly from other places.